Peshali, you are live now.
Good morning, everyone. Welcome to Empower Cell live webinar series. Today we are talking to an eminent panel on winning with COVID, global learnings and way forward. Let me warmly welcome our panelists who will be joining us from different parts of the world. Introducing the panelists, we've got today Ramita Vikramasinghe. He's a master's candidate and civil engineer from Saitama University, Japan. Yasasi Gunaratna, she's an international business coordinator. She's joining us from New Zealand. Dr. Dulshara Amarsekara, she's a former PhD candidate from Chungam National University, South Korea. Then we have Chanaka Varnakurasuriya. He's a research engineer, Technical University of Berlin in Germany. And we've got Dinal Idrusinghe, he's an MBA candidate of NUS, and he's also the founder of Surmount Ventures. So today's forum is about taking global learnings. As we move on to the next week, Sri Lanka will open up slightly, and the country will be back at work. So this forum is about getting the learnings from the rest of the world who are ahead of us in the curve and who have managed it well, and what Sri Lanka can learn from them in the new normal, how to mitigate any risks, and how we get over as a country. So without any further ado, let me invite Dinal to start with today's webinar. Before that, let me also give you the context how the webinar will work today. The first 5 minutes, each speaker will take on chronology of events took place in each country and the measures that each government took. In the second round, they will also talk about how each country adapt to the new normal and how they are moving forward. And third round, it's about closing remarks. So with that, let me invite Dinal. Over to you, Dinal.
Hi, Peshala. Thanks for having me on this Empower Sri Lanka panel. Just going to share a screen. Can you see the screen, Peshala? Can you guys see the screen? No?
No, not as yet.
Just a second.
Sure. Yes, we can see it now.
Great. It's on full screen, is it?
Yes, it's on full screen now.
Great. So we're going to just want to share some interesting insights from Singapore as it took on COVID. So on 22nd of January 2020, Singapore formed a multi-ministerial committee which included the Minister of National Development and the Minister of Health. They chaired it, while the Prime Minister, the Deputy Prime Minister, and the Minister of Finance were advisors. The very next day, we had the first Wuhan case in Singapore. That was an imported case from China. Very quickly, Singapore has a disease outbreak response system condition. It's called DORSCON. They have a level of disease spread threat. So this was moved. There are 4 levels. The third worst is orange and the worst is red. So they moved to orange pretty quickly. Orange means that the disease is severe and spreads easily from person to person, but has not spread widely in Singapore and is being contained. So ever since it moved to DORSCON orange, it has remained on orange since then. On the 7th of April, Singapore went into a semi-lockdown. They term it a little differently here. They call it a circuit breaker. They frame it differently. So they went into a circuit breaker where offices were closed. All classes on campuses were asked to be moved online. That was on April 7th. So they initially put it for a month, and then they have extended it till the 1st of June. Just some look at the numbers. You have total cases of 21,707, 1,245 hospitalized, 20 deaths. What's interesting is the death rate is 0.09, which I think when you compare globally, it's a low rate. And the total discharge have been 2,040. Just an overview of some of the responses. Hospitals and nursing homes, the ICU hospital capacity expanded, medical facilities for patients with mild symptoms expanded, prioritized testing for 30,000 staff and residents of nursing homes, government facilities facilitated lodging for nursing home staff on site or in hotels. So these are some of the steps the government took. This is interesting, the testing rate, the swabs. As at 4th May, 175K tested, unique persons swab 123K. Swabs per 1 million was 30,800, which is an interesting figure. And total unique person swabs were 21,600. The main spread in Singapore has been community spread, but has been in the migrant worker population. So we have a lot of migrant workers in Singapore who do very important work in construction, etc. And this community, it infected quite strongly. And this even got exposure on CNN, etc. So the government has been proactive since that happened. They've given on-site medical facilities, community care facilities, meals, care packs, SIM cards, Wi-Fi access, free movies. They're making sure employers pay the salaries on time and even look at remittance services. Some actions of the government, I mean, they launched a contact tracing mobile app on the 20th of March that has 1.4 million users. So that's about a 20% penetration. Reusable masks were given to Singaporeans and residents. They brought overseas Singaporeans home, and Singapore is known for its legal measures and discipline. And I mean, one enforcement officer was attacked. We had one incident, and they're charging him for attempted murder. They communicated it. Very quickly, in terms of the government communication, I really recommend you look at the Prime Minister's May Day speech. It's available on YouTube. He communicates regularly, and he's taken a lot of leadership, and he shows a lot of empathy. Government sends WhatsApp messages twice a day, and there's also a very informative Health Ministry webpage. In terms of the response in the economy, there was a 60 billion stimulus from reserves. They're not debt, reserves. And 75% of all of the first 4,600 Singapore dollars of workers were paid by the government. Government is training all workers. A 19 billion Singapore Airlines bailout has been given, and hotels paid for by the government as quarantine centers. So that's just an overview about Singapore.
Thank you, Dinal. Thank you for a very informative introduction about how Singapore has, the chronology of events took place in Singapore and what the government has done. Let me now move on to Dulshara. Dr. Dulshara, she'll give us an introduction of South Korea, how South Koreans had been able to manage COVID and what took place there, and what the country is doing. So over to you, Dulshara.
Thank you, Keshava. 안녕하세요. Be well, everyone. So South Korea is 97,230 kilometers in square kilometers in size and has a population of nearly 52 million. And on 20th of January, their first case was reported. A Chinese national, she was found at the Incheon International Airport. And from 19th January to 18th February, only 30 cases were reported and no deaths. But after that, the patient number 31 within 10 days caused more than 2,300 cases because she acted as a super spreader there. Because she has traveled to crowded spots like the city of Seoul and Daegu. And she was even involved in a minor traffic accident and checked into hospitals. And being a patient there, she has visited the Shincheongi church services in two occasions, and she has even gone out for lunch with a friend. So by February 20th, the confirmed number of cases increased to 100, and the first death occurred, and the government raised the infectious disease alert to red. However, due to the effective measures taken by the government, they could really control the disease condition, and by 30th of April, they reported no domestic COVID cases. So up to today, there have been 10,840 cases and 256 deaths. Social distancing, they implemented very strict social distancing rules. And in Seoul itself, they had nearly 10 million people working from indoors. And all the municipalities in Korea, they perform their duties online by having virtual meetings. They stopped gatherings, no night outs, no religious gatherings were allowed, no indoor fitness facilities were allowed. Schools and the universities for undergraduate students remained closed, but the postgraduate students were working under very strict safety conditions. And wearing masks was made compulsory in the country. But in the early phase, there was a problem with short supply, but the government then encouraged the companies to ramp up production. And then they had a 5-day rotation face mask distribution system. And in this system, they gave the mask according to their NID numbers. And then they did nearly 15,000 tests per day. Over 660,000 tests have been done so far. And they have also done this drive-through testing facility where the symptoms will be checked, samples are collected, and payment receipts are done in one-stop fashion under 10 minutes, and your results will be given to you within 3 days. Government also did door-to-door visit services in the high-risk areas like Daegu, where they conducted diagnostics testing for the senior citizens and those who had health issues. Korea is famous for using information technology for flattening the COVID curve. So they use the mobile technology. So all Korean citizens, they were getting latest information about COVID-19 outbreak, updates, real-time information, the confirmed cases and emergency alerts. They also had this open data website by the Seoul Metropolitan Government, which allowed citizens to access to all patient data where they have gone, even the names, the restaurant, shops, or if they even the minor information like seat number of the cinema, so the patients, the general public can take precautionary measures, and if they develop symptoms, they can quickly go to the hospitals. Then they have developed a self-diagnosis application to monitor the inbound travelers, and also there's a self-quarantine monitoring application to monitor those who are under quarantine. This application has 3 functions: a self-diagnosis function, and then a GPS-based tracking system to prevent those who are escaping from self-quarantine orders, and also to give information about self-quarantine guidelines. Then all cases excluding mild cases were immediately hospitalized in South Korea, and the health staff conducts monitoring of mild cases at least twice a day. If symptoms are aggravated, they were immediately transferred to healthcare institutions. And when symptoms are mitigated, they were discharged. So physicians and the nurses were recruited from public hospitals. Whenever they were needed, they were dispatched to high-risk areas on continuous basis. And the government temporarily permitted doctors to perform telemedicine so that the patients doesn't have to come out of their houses. And the financial aid was given for Korean citizens. The local government has given nearly $1,000 per person, and the regional government has given from $400 to $1,000 depending on their family size. And tax reliefs, financial and fiscal support was given to small, medium, and micro business owners and export industries. They did not close the airports, but on 4th of February, they closed for the passengers who are coming from the Hubei province of China. And then the buses and the KTX, I mean the train services, they continued, but after every turn they had to undergo disinfection. Food and agricultural product, they anyway have a very efficient online mobile shopping delivery service. So during this period, this was more frequently used and more efficiently done. So no panic buying was reported in South Korea, largely due to this transparent, accurate delivery service and transparent information sharing service. So people did not have any fear. So I think I'm running out of my time. South Korean government has actually taken a lot of measures to prevent spread of COVID. So I will stop from here.
Thank you very much, Dr. Dulshara. That was very informative, and you took us through the, very detailed. Thank you very much. So probably we'll talk about how South Korea is going to move forward in the next rounds. Now let me bring in Chanaka. Chanaka is joining us from Berlin. Chanaka, when I looked at the numbers in Europe, the Sweden, Netherlands versus the other countries, Germany is the country who has done it well, right? Really well. So could you give us an introduction about what Germany had been doing and the chronology of events took place, and what the government measures taken in terms of economy and in terms of managing this? Over to you, Chanaka.
Yep. Thank you, Faisal, and thank you for having me. And I hope everybody is doing pretty good in this rather strange circumstances, right? And let me share my screen. Actually, that's a better way to do it. So, can you see my screen now?
Yes, we can see it.
All right, just give me a minute. Well, actually, I can remember a few weeks back, German government declared the whole situation as one of the most, the biggest challenge that they are facing after World War II. Actually, they were not wrong. It was really serious here as well, and you could really see the strain from the faces when you talk to the people here, and it was really it was really serious here as well. Well, actually, from the beginning, the measures that the German government took were really effective. And then the thing is, this come to few things actually. German government understood their citizens, they understood their economy pretty good, what they're capable of. And then of course, they traditionally have a really robust, very strong healthcare system. It's a universal healthcare system. This is really strong. And not only that, from the beginning, the things were, by the end of January, this is the starting point to Germany, if I may say. The things were really unfolding in China, Italy, and France. And Germany learned from them and learned quickly. And from the beginning, they knew the initial phase is the most important phase in this COVID-19 impact, you know. And from the beginning, in the initial phase, that means end of January to end of February, German government took swift action, because it's a swift decision making is the most important thing here. And in the first place, they released funding for research and development, so they could increase the testing capacity and ramp up the hospital capacity. If we come to testing is a baseline, right? If you don't do testing, it's like different shades of gray. You don't see how the virus is spreading, what's happening to the population, where should the measures go. So from the beginning, German government is doing the testing. A large amount of tests were done from the beginning. And that means they were doing testing for the mild cases, asymptomatic cases, as well as the critical cases. So this is really important. And the second thing is ramping up the hospital capacity. In generally, even for a developed country, Germany has a really high number of ICU beds. It's more than 25,000. And within 10 days, they managed to increase this to 40,000. It was really pretty admirable, actually, how they did it. And in the first phase, they were concentrating on this one. They knew from the first phase, you know, if you take this swift decision in the first phase, then the second and third phase will be much easier for them. And when we come to the social distancing measures, they were a little bit worried about people panicking. So if people start to panic, it's nothing going to happen, right? And the initial social distancing measures, this is end of January to end of February, were a little bit light. Only big occasions were cancelled, the football matches were cancelled, that's it. But when you come to the second stage, This is the end of February to end of March. This is the time that World Health Organization declared COVID-19 as a pandemic. And right in that date, German government declared the strict social distancing measures, which is we couldn't really go out. All the shops were closed, all the restaurants were closed, and so when we go out, we could only go as a pair, not as a group. So it was really strict here, and even the police started to control it. But they knew from the beginning they took the right decision. They understood the timeline of the pandemic, the timeline inside Germany as well as the timeline outside Germany, the global timeline. So they knew the second stage. At the end of second stage, the people will start to lose jobs. Companies will start to close their production lines and etc. So the financial strain will come into effect at the end of the second stage. The financial strain, you could really see it from the people, from the citizen. And then they roll out in the second stage. At the end of the second stage, they roll out the stimulus packages. This is more, the first stimulus package. I think it's around 800 billion euros. And there was another stimulus package called Stabilization Fund. This is for the struggling businesses. It is more than 600 billion euros. There were low interest rates. And from the beginning, there were low expensive credit schemes. So they were really generous. Germany is one of the most generous countries in terms of financial measures in COVID-19. So now in the third phase, even though in the second phase the cases are rising, and at the end of March we saw 50,000 cases. The community spreading is already happening, but they knew the curve will flatten out, and you can already see from this graph here. So at the third stage, this is the end of March to end of April, the reproduction rate drops to 1.7 at the beginning of April, and it was really the decision that they took in the first place, in the first phase. And at the end of April, the reproduction rate was 0.7. So we saw 100,000, even though we saw 100,000 cases, we saw 100,000 recoveries as well. This is really due to the measures taken or swift decisions that government took. So all in all, everything comes down to one thing. It's the quick response by the government and the disciplined people, the people support for that swift decisions.
Right. Yeah, thank you. Thank you, Chanaka, for that detailed introduction. Actually, Germany had been quite impressive in managing it, looking at the total population and how they have faced it out and how they have identified what actions to be taken and stage, and also how they have identified.
They understood the timeline from the beginning. That's the only thing, and they took the swift decision. So that's all. It's all come to this governance problem, So that's the most important thing that we can learn from this COVID-19 pandemic.
Yeah, and they've been very proactive as a government.
Yeah,
perhaps
exactly.
the financial muscle that they have would have probably made them more comfortable to go into any action.
Sure.
Yeah, so we'll discuss this later in the webinar. Now, let me move to Yasasi. Yasasi is joining us from New Zealand. And New Zealand has now, I think, officially kind of opened up. And they are now they are phasing out in managing C19. So Yasasi, now please take us through what happened and how New Zealand was able to be ahead of the curve and play a sort of a leading role in managing this C19 to the rest of the world. Perhaps I think the Prime Minister Jacinta had been taking a very inclusive approach with business community. And being a very young politician, she has perhaps included all sectors in managing this the C19 crisis. Please take us through how you all managed it and what went well for New Zealand. SSC, over to you.
Thank you, Peshara. Good morning to everyone. I think I heard what other people said about their countries, but when it's come to New Zealand, I think New Zealand decision to pursue an elimination approach was vastly different approach to usual pandemic planning. I think which has historically been based on mitigation model and focus on delaying the arrival of virus, followed by a range of measures of flatten the curve of cases of deaths. And when it's come to New Zealand, the first COVID-19 reaction situation happened in New Zealand is around February 3rd. The New Zealand government places entry restriction for people who come in from mainland of China, and they were asked to self-isolate for 14 days. Because that time we didn't have any threat of COVID, because I think because New Zealand is in the one corner of the world, so maybe the other part of things happening in other part comes a little later in New Zealand. Then I think we never thought it would be like a real pandemic situation in New Zealand as well. It was just a restriction for Chinese people who are coming from mainland of China. Then in February 28, the first case of C19 reported in New Zealand. That was one male around 60 in his 60s who came from Iran via Bali and via Bali. So that was the first case reported in New Zealand. And then after that incident, I think from 29th of February, the health staff began meeting direct flight landing at New Zealand airports from Hong Kong, Japan, South Korea, and Singapore and Thailand, because those are the countries were affected by that time. Then I think second case reported in around March 4th, an Auckland woman in her 30s who was visited from Netherlands from Italy. She was the second confirmed case of coronavirus C19. Then one by one, countries started closing the borders to the outside world, and word coronavirus became part of our daily vocabulary. That's the time it actually hit and started in New Zealand, like by around beginning of March. Then I think by March 12th, WHO confirmed C19 as a pandemic situation. And the New Zealand government announced anyone entering New Zealand must self-isolate for 14 days, except those arriving from Pacific Island, because Pacific Islands were safe that time. There was no cases confirmed. But for the outside world, just PPM has decided to quarantine everyone coming outside from other side of the world. And cruise ships are banned, totally banned for, and strict border measures for people traveling from New Zealand to Pacific are put in place, including health assessment was required. And on 16th March, Prime Minister Jacinda Ardern says tourists who are entered New Zealand and don't self-isolated, and they were planned to deport who didn't want to support the government in quarantine measures, because some people were not used to it, because New Zealand is a country mainly based on tourism. So what we are getting mostly with tourists. So if they quarantine for 14 days, that means they don't have much time to spend in the country. Then that's what Jacinda PM said, that if you are not cooperating or just quarantine, you just please get out of the country. So then slowly we were like foreigners, tourists will stop coming to the country. And I think then by the 21st of March, 19th March, border shut down for all the citizens except the New Zealand citizens. And I think by 21st March, the government introduced the 4-level alert system to help combat COVID-19. I will share the screen with you to show you what are the measures, how this alert system works. So this was the 4 levels. First one is level 1 is to be prepared. The second is to reduce. Third is to restrict, and
yes, you're not sharing the screen with us.
I'm not sure. Sorry.
Yeah.
Yes. So these are the 4 levels, and when by the time like around 12th March, we were in the level 2, which was reduced. But by 21st of March, the government, 25th of March, when the COVID cases reached around 102 cases the government decided to go for level 3, which is there were like sort of restrictions for people, not mass gatherings, and schools were like, some
Let's say,
schools were closed.
can put full screen.
Yeah.
Yeah.
Schools
you.
were closed down, and the religious gathering was cancelled, and mass event wedding were cancelled. People couldn't gather more than 100 people. Those kind of gatherings were cancelled during that level 3 restrictions. And then once the cases reached into 280, the government decided to go for level 4, which is the total lockdown. That was actually 3 days after this level 3, and government gave people 48-hour notice for them to shut down their businesses and people to stay home, and all the education facilities were closed, and all the religious places were called, restaurant, bars and gyms, everything was closed during that level 4. And people were asked to stay home, and people were allowed to go for walk. It was not like in Sri Lanka, it wasn't a curfew situation, but people were asked to stay home. I think New Zealanders, they took it really positive way, because they also kind of scared of the situation, because it was, I think, here people here, like, they have very peaceful life. They don't have much things happening other than the rugby or other netball or cricket. Or other than that, they don't have much excitement. So once the corona hits, and when the lockdown happened, I think people took it positively, and they really nicely cooperated with the government. And because people were informed, one thing I should be appreciated about this government, every day PM Jacinda Ardern, along with the Direct Health, she conducted a press conference, and she gave all the information to the people. She never kept anyone in dark. Every measures taken, and all the reports, deaths and economy and everything, she updated people every day. So that one thing, I think we should be appreciated this government, because people knew what's happening and people aware what was happening. So it was, and other than that, Jacinda Ardern being the prime minister, she regularly appeared on social media, smiling, sharing part of her personal life under lockdown without underplaying the seriousness of the situation. It helped people to build trust in their day-to-day life as well. And after everything, when I talk about the economy, government actually supported the business. Actually, the government want to save the jobs and keep the business. Even during the lockdown, the business cannot be like this. Even the business locations will start shut down. So government wanted to help this small business and people, because they want to stop people losing their jobs. This country went for 4-week lockdown, so that was kind of a huge lockdown for economy. And so to cushion the impact of New Zealand economy, government announced a 12.1 billion package worth 4% of the GDP. The package includes a 500 million boost for health, 8.7 billion support for business and jobs, and 2.88 billion income support and boost in consumer spending. To help local business, the government provides a few incentives, such as the wage subsidy scheme, business finance guarantee scheme, and the ensuring the small business cash for loan scheme. As of May 1st, the government has paid 10.6 billion of the wage subsidy to 1.7 million people in New Zealand. So that's kind of a biggest thing the government, in a way, government has done their part to safeguard jobs and the business. So that's how the government reacted during this past lockdown and level 3 in New Zealand.
Okay. Thank you, SSC. Thank you for that introduction, and thank you for taking us through what New Zealand had been doing. Now, I think out of all the countries, the country which took the biggest hit is Japan, because they compromised. I mean, they had to postpone Olympics, right? So now let me bring in Omita, who is joining us from Japan. Omita, I think it's a tough call for Japan. After all, it's a very good opportunity. I would say the biggest opportunity a country would get to perhaps to brand the nation, right? To tell the world who you are and to get out to the world. It's one of the biggest opportunities. So now Japan has taken a step back, and Japan now is looking at 2021 Olympics, I think. So tell us how Japan had been able to face this C-19 crisis and what the government response had been so far. Over to you, Amita.
Hello, everyone, and thank you, Peshela, for inviting me for this informative session. And rather than statistic, I would like to share some political and economical measures that the government has taken to combat this.
Just a minute, let me interrupt you.
Okay.
Yasati, you need to...
Sorry. Yep.
Yeah, Amita.
Is it okay now?
Yeah, okay, good to go.
Okay. Thank you, Peshela, for inviting me, and hello, everyone. So rather than going with statistic, I would like to share some political and economical measures that the government has taken here to combat with this pandemic. So starting from the history, we here recorded the first COVID-19 patient in mid of January. So from at that moment, the government was awareing and alarming the public to be careful about this virus, and all the media, including public and private, they were talking about this COVID-19 pandemic. And then due to the rising of the COVID-19 patients, the Netherlands island of the Japan, Hokkaido, they declared a state of emergency in that island. And following in the 2nd of March, the central government declared to close all the schools in nationwide in the Japan. So, but after that, the suddenly discussions in media were changed. So basically they were targeting COVID-19 earlier. In the early March, they were suddenly disappeared, and all were talking about the necessity of holding the scheduled Olympic. And so meanwhile, the WHO declared this is as a pandemic. Then a lot of debates, arguments originated in locally here, and as well as in globally. So is there any necessary to hold Olympic because we are in a pandemic now? So with these discussions and arguments, in March 24th, IOC, International Olympic Committee, with Japanese government, they postponed the Olympic to the next year. And what happened was the day after this postponement, a huge number of COVID-19 patients were recorded in Tokyo. So that was something very fearful thing to Japanese to experience. Suddenly the day after day, once they postponed the Olympic to next year. So moving on with the calendar, in April 7, central government declared a state of emergency, including 5 prefectures. And in 16th April, it was expanded throughout the nation. And it was expired on last 6th, and now the state of emergency has been extended to another month. And this is not something a fully lockdown. During this period, essential businesses and services, and they will continue as before, and people are asked to be at home. That is just only request. And what happened due to this extension of state of emergency by a month, it is predicting that jobless number will increase to 800,000 here in Japan. So that is something very serious. So government is trying to provide stimulus economic packages to combat with this economic crisis that has occurred due to COVID-19. So they have approved an extraordinary budget in 30th April, and it provides 117 trillion yen as an economical package, and it is equal to 20% of the Japanese GDP. And the Bank of Japan is maintaining the interest rate. They say that short-term interest rate will remain around minus 0.1%, and as well as the long-term interest rate will remain at 0%. So they want to ensure the money flowing between financial institutions and with the companies. And Ministry of Economy and Trade Industry has established a stimulus package to finance small companies which are severely hit by this pandemic, and because these small medium enterprises are located in local and regional communities. So it covers a wide variety of corporations, including medical sector, agricultural sector, and as well as enterprises such as NPOs, non-profit organizations, and including welfare corporations also. So by doing so, the government wants to ensure that employees get 100% their monthly wages. And with this 117 trillion yen economic plan, they estimate that over 3 million small enterprises will be survived, and over 10 million employees in Japan, including local and foreigners, will be okay by this economic package. Not only that, a lot of subsidies are given to some companies, like those who are producing face masks or producing artificial ventilators, those who are taking countermeasure actions against this COVID-19. So government want to ensure the sustainability of those businesses as well as to increase the production of those companies. And finally, the most attractive action that government has taken is to give 100,000 grant to all citizens, regardless their income. So if foreigners have minimum 3-month residency here, they also entitled to apply this grant. So those are the key decisions that up to now the government has taken to combat this pandemic. Over to you, Kaishala.
Thank you, Amita, for that introduction. That was very insightful. Now, moving on to the second phase of the webinar, let me go to Dinal. So in this, the second phase, all the panelists will talk about how each country adapt to the new normal and how they are moving forward. So far we discussed the chronology of events, what took place and the measures taken, and now it's about how each country is like, what are the measures taken to move forward and adapt to the new normal. So over to you, Dinal, enlighten us with us how Singapore is going to go ahead.
Sure, Peshala. Let me quickly share the screen. I take it you can see the screen?
Yes, you can put it full screen, Dinal.
Sure. Is it full screen now?
Yeah, perfect.
Great. Looking ahead, very interesting situation. So the government is looking at this circuit breaker. They want to gradually release the restrictions. So on 5th of May, traditional Chinese medicine is very popular in Singapore. They opened the outlets. Exercise and dog walking in condo and residential grounds was allowed. In a couple of days on the 12th, cakes, confectionery, snack and dessert outlets are open. They were closed. Don't know how some people like myself manage without that. But barbers, hairdressers, for basic haircut services open on the 12th, retail laundries, retail supplies. When you look at the economic side, the expectation is that the economy will contract almost, Citigroup predicts a -8 contraction. Ministry of Trade and Investment has said 1 to 4% in 2020, but they may revise that soon. But it's very interesting because the strategy is Singapore knows it's small and highly globalized. So it's very susceptible to the risks of COVID, but they also realize that their strength is when you're small, you're nimble. When you're globalized, you're connected. So you can quickly identify new growth areas and move into those. So there's a strong push on medical, biotech, food, and IT going forward. Not necessarily just in Singapore, but there's a strong drive in Singapore. I mentioned about the 60 billion stimulus. What's interesting here is they came out with 5 billion within 2 weeks of COVID hitting Singapore. So the minute COVID hit, the government announced it. What it did was it signaled to the economy. Taking 75% of the wages of all businesses up to $4,680 gives you a buffer. And it's very interesting how proactively they came out with it. And of course, this 60 billion stimulus is all coming out of reserves. So Singapore had, the government had generated excess, earned excess cash over a period of time. they are using this now at a downturn. Also, in terms of future, the businesses that open up, some will open up on the 12th of May, others will open up later. 70% of the businesses were telecommuting even before the circuit breaker. So there are different shifts and different work locations, safe entry at workplaces, distancing, masks on premises. So those are initiatives that will be taken forward. Also, I mentioned about this app, right? What was really interesting was now 1.2 million people got on this app. But the way people started adopting it, I mean, generally when the government wants to know where you are located, what, there are a whole heap of privacy issues that come, but people proactively got onto this. So there's this, the government came and said, we will not use this information for anything other than COVID contact tracing. People believe that. A lot of people believed it. Some may not have, but a large number of people. So that shows the trust they have and the credibility that the government has. Also, just, I mean, interesting perspective was my perspective here at NUS Singapore. I mean, Singapore, NUS classes gradually decreased from 50 to 25 to now fully online till June 1st, and we'll take it from there. I have to upload my temperature twice a day in an online system. Sometimes when you go to the cafeteria to take takeaway, you can't sit and eat there anymore. They check your temperature. So they're very proactive. 1,000 NUS graduates are to be employed by the university as a result of COVID. So a lot of graduates, it's a tough time to enter the job market now, but NUS is taking these proactive measures, free online courses. I mean, I had a full semester from mid-January till end of April. Not a single deliverable was compromised. Like, they moved online, but they didn't, unfortunately for us, reduce our workload. So despite COVID, we had a very productive semester. So that's just an outlook of the way forward. That's it from me.
Okay. Thank you, Dinal. I think, having 1.2 million people on an app, which is trusted from a 5 million population, it's almost like 20% people are on the app. So which is quite, I think, then it allows the government to directly communicate with individuals, right?
Sure.
So I think that's, I think in fighting C-19, the digital readiness of the governed particular nations also matter. I mean, thank you for that insightful overview, Dinal. Now let me bring in Dr. Dulshara. I think South Korea has, likewise, Singapore, South Korea also had taken technology and to fight C-19 proactively. So how South Korea is going to adapt the new normal and how they are going to move forward? Could you enlighten us, Dr. Dulshara? Over to you.
Yes, Dinal. As for now, South Korea has ended its strict social distancing campaign, and they have begun the everyday life quarantine scheme from 6th May. And that would allow people to engage in a certain level of economic and social activities. So the schools will reopen in stages until June 1st. They will start with the high schools. But the students will have to follow certain guidelines like wiping down their desks, open the windows when they get into the room. And they also have to wear the mask in the classroom, get their temperatures checked regularly, and they have to do social distancing. For example, there will be walls set up between each student in the cafeteria. And at the meantime, the ministries have decided to give some amount of money to provide thermometers, hand sanitizers, face masks, thermal cameras for the classrooms. And in any case, if one case is reported in these schools, they will be quickly converted back to online learning system, but only that particular school will be converted to online learning. So again, the government has announced that they are going to give some relief money to the people who are not getting the employment insurance, or other freelancers like home tutors, translators, and gym teachers. So let me share my screen to show you how they do this. One second. Can you see? Can you see?
No, you're not sharing the screen as yet.
Okay.
Now we can see.
Okay, this is what they are going to do in school cafeterias. This is my university where this is done in their cafeteria for the postgraduate students. So the same thing they will do in schools as well. Okay, so then like other countries, South Korea's economy also recorded a severe contraction due to the drop in country's exports due to this pandemic. So all the world's top credit rating agencies have reported that the Korean economy will also grow in the reverse this year, and the country will. But the country is much better than the other major economies because they have a massive testing policy instead of a lockdown policy. I would say they did not have a lockdown policy. They had a massive testing policy, so the economic damage appears to have been less severe. So to overcome the post-corona economic crisis, the government is to announce the Korean version of the New Deal policy. This includes support for urgent job security, creation of public youth jobs, strengthening employment retention, support for unemployment, livelihood, and re-employment. They have also allocated $69 billion to save their key industries such as aerospace, shipping, and car industries. I also have to mention about their biotechnology industry, which has earned almost $157 million by exporting COVID-19 test kits to 106 countries as of April 20th. They are also coming up with something called K-quarantine model. The name is interesting just as K-pop, on guidelines detailing the country's COVID-19 response measures. They are planning to actively utilize this K-quarantine model to expand the new markets and promote national status. And the government will also draw up plans soon to help South Korean firms to win bids for foreign infrastructure facilities. To conclude this session, even though South Korea appears now to have the virus under control, the economic crisis created by COVID remains for a while. So South Korea has now turned its attention to economic recovery and focuses on creating jobs and boosting economy with economic growth and innovation for the post-COVID era.
Okay, thank you, Dr. Gulshara. So now let me bring in Chanaka. Chanaka, Germany is a highly industrialized country and perhaps plays a major role in the EU. So Germany's economy will perhaps, any impact to German economy will have an impact to Europe and also in turn to the world as well. So now the COVID crisis, they've been very proactive, identifying the different issues way in advance and then giving specific solutions. So now the new normal, how are they ready with the new normal and how are they going to move forward, adopting and moving forward, Chanaka?
Thank you, Pesala. And actually, I will start with an old measure that Germany already has. It's a very German system. Germans are really good at planning things ahead. You know, it's really good to learn how the disaster mitigation plan, how we can implement a disaster mitigation plan, right? And as we know, as we discussed early, when the virus hits, people start to lose their jobs. People start to feel the strain of the financial strain, if I would say. And this is the basic term is people start to lose the jobs, right? In Germany, there's a scheme called Kurzarbeit. In German, we call it Kurzarbeit. The name is short-term work. That means when the people start to lose the jobs, government will take over the salary component of it. That means government will pay the salary until end of this disaster. So the salary is not 100% for sure. 50 to 60%, they will pay 50 to up to 67%. They will pay, But what is most important thing, I already mentioned earlier, Germany, from the beginning, they understood the capability of their economy, and they understood their economy pretty well. And it's a manufacturing economy. It's, as you mentioned already, it's a manufacturing economy. It's not a service economy that like what we are having in UK and Sri Lanka, for example. So what is really important about the scheme is after the pandemic, after this disaster, the key industries that's gonna go online is the manufacturing things, building of machines, and Dinal mentioned some of these things, biotech and information technology and etc. So by allowing people to keep their jobs, Germany is really in a good position to bounce back pretty quickly after the COVID-19. So this was really evident in 2008 economic downturn. When the economic downturn happened, Germany bounced back pretty fast because they had this Kurzarbeit, the scheme. But what we could learn from this one is it's really important to have a catered system for the own country. We could learn how we could have a long-term disaster management plan. That's really important. How what we could learn from this this COVID-19 whole story of COVID-19. So when it comes to new normal and new forward, in foreseeable future, for sure, we cannot expect that everything will go to normal that we had like 4 months back, for sure. And you know, EU is a very we can move everywhere. It's an open border system. For example, I could go to Poland within 1 hour. So it's really now every borders was closed, but in Germany is in a positive curve right now, as I mentioned earlier. So Germany is starting to ease out the strict measures that they have taken, but it's really important. Every easing out comes with the strings attached to it. What that means is if the infection rate goes up, they will immediately go back to strict measures. That's really important. So that means no parties for the coming few months, no big gathering for the few months ahead. This really, I mean, if I may tell a small example, in Spanish flu in 1980s, when it happens, San Francisco, the curve was rising as normal, and it was flattening out at one point. And they ease up the restriction without consulting their, I don't know, their professionals and etc. And the second wave hit. If the second wave hits, it will be really bad. And in San Francisco, I think somewhere around 50,000 people died. And also, we could learn from the past, right? In the last patients were found in 1950s from the Spanish flu. It is 40 years after. That means we have to learn how to live with the virus. We have to adapt. People are good at it. Humans are really good at adapting. So we could learn, and we cannot take we cannot take everything. We cannot turn everything overnight. We have to take baby steps, and the steps should be really careful. The steps, the decision-making process should be really rational, and that's what we could learn. That's my opinion. That what we could learn from this whole pandemic situation, and how these countries, from the approaches from these countries, right?
Now, since Germany has a very a strong manufacturing base, how are they going to start manufacturing the factories? Are they going to open up? Like, how much the factory working arrangement would be like?
This is the case. The first thing is, I already mentioned this, the Kurzarbeit scheme. This is one component of it, right? I mean, by Kurzarbeit scheme, the skilled workers, they are allowed to keep their job, but the company is not paying the salary, but the government is paying the salary. So when after the COVID-19 pandemic, the companies will need a lot of skilled laborers in order to ramp up the production capability, right? So, but by having this Kurzarbeit scheme, companies avoid the hiring process, hiring cost. So they already have a skilled worker, so they can ramp up their production rate pretty fast. That's the one thing. And the second thing, what we have to understand is, for a manufacturing economy, it is really hard to, I mean, this is really not a good time to sell cars to the world, right? So there also depends on the other countries. And that means the economy also has to adapt. And Dinal mentioned the biotech industries and information sector. They are the most the industries that's really in high demand. So the government will start from there. They will start to adapt, and from there only we can. This adaptation is really important, but adaptation also should come in a really calculated manner. It should be rational adaptation. You cannot start in the first place. You cannot start with producing cars, because that's not the way it should be. So that's what I mentioned in the first place. The government should have a really good understanding into their economic system, what kind of economic system that they're having, and also the capability of their economy. That's really important, you know. So
what I wanted to know was, like, you know, now in terms of the worker remuneration, like, you know, the composition coming from the government and the composition coming from the employer, it's understood. What I mean is, like, you know, how, let's say if a factory had 500 people working, will they start with 50, or, like, you know, the in terms of working arrangement, whether how they are planning on that side?
You're exactly right. I mean, they're not going to start like 100%. They are not going to ramp up the production to 100%. For example, if you have 3 production lines, they will only start 2 production lines. That means you can keep the hygiene measures, you can keep the social distancing measures. Of course, you can have whatever the masks that you can wear, you can do those things. For sure, in the coming 3-4 months, I think that's the period that they will use to slowly increase. It's not an overnight case. So as you ask right now, they will start only 1 production line in one company, maybe another 2 in another company. So likewise, they will start step by step. So that's what I mentioned in the last part. These baby steps are the really important thing, you know. It's gonna hurt people, it's gonna hurt companies, that's for sure. But if we are really quick to take decisions, then the effects will be really bad. I mean, really adverse than what we are having right now. So we have to be really cautious. So of course they will go step by step. And I can give you another example. That we have big shops here. If you think about electronic shops and etc. And in the first stage, only 800 square meters were allowed to open. So the shops were opening first. I mean, they adapt a really nice system. In the first day, in the Monday, you have another 800 square meters open. In the second day, they will open another section because they could open 800 square meters in the first month. So then they will ramp up to 1,600, maybe 200. And likewise, you know, those are the steps that you should take. And those are the calculated steps that you should take, we should take. And only that's the baby steps is the only way to go forward in this pandemic.
Thank you, Chanaka. I'll come back to you because Germany is quite interesting case. Now let me begin, Yasasi. Yasasi, how is New Zealand now? Like, you know, I know we have still closed borders, but perhaps now y'all can start, like, you know, the business operations and all of that now has kind of started. So how is the new normal for you? And like, you know, what are the measures taken and how are you going to face how are you going to move forward with C19?
Thank you, Pesha. I think as Chanaka said, I think New Zealand is also taking very small baby steps. And we just came out of a 4 week of lockdown, total lockdown. Now we are in level 3. Level 3 as of people can go to work who has to physically appear to the work, and all the people who can work from home still working from home. And even the cafes, restaurants are open, but no one can go and dine in. Only deliveries and takeaways are open. And still gyms and schools and pools and sports all are still closed. And companies like manufacturing plants, they are open, but they are taking strict safety measures, such as Chanaka said, they have cut down people and all the safety measures are taken, and government inspecting the places like where people come and go, and strictly people who are doing shift, they are not allowed to mingle with each other. So if one person is doing one shift, he has to do the shift, finish the shift and walk away from the doors, then the other persons are allowed. Like before that, some companies, they have hired people only to clean the premises, like door handles and tables and lockers and what other like areas that people touch and contaminated. So, as Chanaka said, like economy has started in New Zealand, businesses are open, but still not completely open. But government has to take some measures, right? Because country has to run, because otherwise there's no country was totally shut down for 4 weeks. Because the impact of that 4 weeks will maybe come after another 2-3 months, because still the government is paying that wage subsidy as in Germany. Some small businesses and medium-sized businesses, they didn't have money to run for 1 month without doing any business performance, because they had to pay rents and they had to pay for employees and they had to pay for other things as well. So what government did was gave a 12 weeks wage subsidy. So if the business cannot pay the salary for the employees, the government gave some money. Okay, this is the amount we are giving to the company. You have to pay this as a salary for your employees. Like some companies actually, they didn't take the subsidy, but they still go for salary cut down, even from prime minister, ministers, and I think almost like 80% of New Zealanders are on a pay cut at this point. Some are like up to 80%, 20%, 30%. So everyone is going through a pay cut. I think in that way, like the company has some sort of way of keeping cash flow, and I think they have gone for rent holiday as well. Mortgage holidays and rent holidays was also introduced, and and the other thing is government has opened a current, like not unlike in Sri Lanka, government has some because New Zealand is a country which has high rate of tourism, and some hotels they don't have business at all because there's no planes coming in, and government has taken those hotels and converted into quarantine center, which is government paid. So people who are coming from other countries, they were keeping in these hotels, and government is paying for bills and everything in that way. And even though in that way, like even though New Zealand is secure from new COVID-19, in New Zealand is a country which is very global, which has very globalized economy depending on international businesses. So in that case, if other countries also not coming to normal, it won't be easy for New Zealand in trade wise. But currently, I think New Zealand is working with Australia, which has a different way of handling the situation. I think PM Arden is in a discussion with the Prime Minister Australia to have a different bubble with Australia. Then slowly New Zealand can open flights to Australia and maybe some organized maybe tours and kind of sports event with Australia. Just keeping a bubble, only bubble, trans-Tasman bubble between New Zealand and Australia. In a way, it's actually good actually for tourism, maybe airlines at least, because last month 300 pilots were redundant from Air New Zealand, which is huge. And I think in the tourism industry, tourism is 6% GDP in New Zealand, and only in last month around 400,000 jobs were lost during last month, which is a huge, because we have only 5 million people in New Zealand. And I think retail industry also 7,500 workers has been lost their jobs already. So in that situation, the real impact of this lockdown will come to show in another 6 to 12 months. So once the government stop this wage subsidy, the business will have to go on their own. So it's like now government supposed to announce the next level. What are we going to do after level 2? Whether we are going to level 3. Now, right now we are in level 3. So by this Monday, government will see all the measures, how the level 3 lockdown, how the level 3 went smoothly or not, and then they will decide whether we are going to level 2. Level 2 is much relaxed, because in the level 2, gyms and pools and sports even will be open. People can gather like bigger bubble. People can create bigger bubble than this, and people can go for work as normal. So government will see all the results and evidence they collected during the lockdown and 2 weeks of level 3, and see whether we are safe to go for level 3. I think the one good thing about New Zealand government is they have all the evidence before lockdown, during lockdown, level 3, which has some relaxed measures. Then they have pure evidence how the COVID-19 is spreading in New Zealand after lockdown. and after borders are closed. So they, based on every evidence, they are deciding whether we are going to lock down, and all the criteria that level 2 should be followed, designed based on all the evidence and measures they have taken during previous level 4 and level 3 lockdown, which is good in a way. It's hard to adapt. It won't be the same world as what we used to live before March. It will be totally different experience for everyone. But I think people will adapt to that, because right now people were isolated for 1 month and 1.5 months, and I think people, till someone find a vaccine, I think people will not trust strangers to have like close gathering, and social distance will be maintained, and big event that if people have planned for big events, everything will be cancelled. And the other thing is, if the businesses has to sustain, they will have to find out new innovation. So new innovative methods will be it's must to have new innovative methods to run the business. If let's say that the restaurant, if you go to a restaurant, if the restaurant is allowed to have certain amount of people, then they will have to come up with new ways to cater people and run the business, because it's not a practical. If the restaurant is allocated for 50 people, and with this all new measures they can accommodate only 25, they will have to come up with some new innovative methods. So I think business owners will also have a part from their side to come up with new measures, new ways, new innovative ways to cater business and ongoing visit. Other things, I think PM Jacinda always encouraged people to support local businesses. Even when she went down to level 3, first thing she said is, go to local cafe, have a coffee, help your neighborhood, help your local business, because they are the people who are highly affected, because small cafes, restaurant, they were affected badly, because they don't have huge cash flow, so they were running with day-to-day money. So I think people are doing it at the best actually, because I have seen people place orders online and go take it, and sometimes they do delivery. So I can see new innovative methods are coming to scene at this point. Yeah.
Okay. Right. So that's a very interesting thought. Opening up, then opening up with perhaps after identifying the markets that are important to you, perhaps identifying the special segment like Australia, and then you said 6% of the GDP is tourism. So whether how to work with Australia, in terms of retaining the sustainable levels for tourism. So very, very thoughtful and very insightful that was. And now let me bring in Romita. Romita, could you tell us how Japan is going to move forward? And also, could you tell us, are we going to have Olympics in 2021, or what's going to happen for Olympics as well? And give us how Japan is going to adapt to the new normal. Over to you, Romita.
Thank you again. Welcome to Japan. And can you hear me, guys?
Yes, very clear.
Okay.
Loud and clear.
Okay. Answering to your question first, I think it's possible to do Olympic in 2021 here, and Japanese are doing well. So why I'm saying that is because compared to the other countries, we have less number of deaths have been recorded here. I mean, compared to the Europe or compared to the United States, it's not the doing testings, but I'm talking about the recorded deaths here. So this low mortality rate indicates, and this is an evidence to say that the Japanese model that has been using to combat against this virus has been a success. I mean, at least up to this point. Now we believe that we are now we have been come up to a later part of this stage in the virus. So what Japanese model is, let me explain you the Japanese model. It has two components. The first component is identifying the clusters and cluster-based approach, identifying the cluster and identifying the infected persons and isolating and quarantining them. Then second component is 3 Cs. They say 3 Cs that we need to avoid to contain the virus. So what are these 3 Cs? First C is something closed environments or closed rooms that has poor ventilation. And second C denotes that crowded places, maybe buses, maybe a train or religious assemblies, and we need to skip those places. And final C represents the close conversations, I mean, having social distance. So these three C's are inherent qualities of Japanese culture. So Japanese government, there's no any requirement to say the people by force to practice this kind of system, because they are inborn qualities of Japanese people. So these are the arsenals of the fighting army of here in fighting army against the COVID-19. And let me take you to the future perspectives in Japan, and a lot of rapid research and development projects are ongoing to address this virus issue. As an example, clinical tests. Sorry.
No, you can go ahead, Pramita.
Okay. Yeah. Okay. Let me say about some research and development projects are ongoing in Japan, and Avigan, maybe you have already heard now about Avigan. A lot of tests are, clinical tests are ongoing to clarify the usefulness of that Avigan antiviral drug. And a few days ago, Japanese government granted approval to use Ebola vaccine in any emergency case, and a neutralizing antibodies testing in these days also. And additionally to these research and development projects, government also targeting social issues. So they have started a remote health consultation program, which provides interviews with doctors and public people, and where public people will be able to get opinions or advices from doctors remotely. And moving on to the technology, this COVID-19 has given a boost to the touchless tech in Japan. So a company has developed an elevator that use enhanced public hygiene, where people do not want to touch the buttons, and payment systems using contactless multi-biometric authentication systems. Security gates have been developed that people do not require to remove their mask or sunglasses, that people are forced to touch their own faces. And recently government has announced that they are going to develop a contract tracing app, so that people will identify if there is a nearby a COVID diagnosed person. So these kind of ongoing trials in tech field are very popular here. And due to these innovations, what has happened is in the market share, some of tech companies have been rising. So this is something positive side of COVID-19, that Japanese tech companies have grabbed those opportunities. Actually, Japanese, when there's a problem or when there's a disaster in Japan, normally Japanese are well capable of grabbing it and take it as a motivation to the development. So in the education sector also, Prime Minister Abe has emphasizing now to give each and every student a laptop with the other required material to accelerate the remote education plans. So that project they are targeting to conclude in 2023. So those are the key informations that I can share, and they reflect what Japanese are doing currently and the future directions in Japan here.
Yes, I think Japanese are known to rise from the ashes from the World War to where it is today, where it is today. And it's very interesting, from 5S to 3Cs. I think probably certain things that Sri Lanka could learn. Probably, I think these 3Cs might be probably will be a global learning going forward. Yeah. So with that thought, now let me move to the third phase and the final phase of the webinar. I will start with Dinal. So this is Dinal at your closing remarks as well. I'll throw a question also at you, because Sri Lanka will be back at work on Monday, right? And Singapore, I think they opened up, and then suddenly you saw a rise in cases, and then they had a kind of a curtail down the kind of openness. So with that, what are your thoughts how Sri Lanka should manage? And you can adopt your closing remarks, Dinal. Over to you.
Peshula, like you said, Singapore actually didn't close at all initially, and then it went into this semi-lockdown phase. Look, of course, I mean, we've heard a lot about 5 countries doing well. We are placed in those countries respectively, but our heart is in Sri Lanka, so we want to know what we can do, what Sri Lanka can do going forward, right? So, of course, one thing that comes out is prevalent testing. With the data coming out of Sri Lanka, one big question mark is whether we are testing enough. Second thing is, I think when you listen to this the corporate leaders who have done some very useful webinars in the last 1 to 2 weeks. They want better communication from the government in terms of consistent communication and a plan so that they can plan. Then the big question is, okay, we've handled the health challenge pretty well, but economically, what are we going to do going forward, right? Sri Lankan economy was in a sensitive state before COVID. Now it has precipitated. So apparel and tourism is suffering. There were 2 key sectors for our economy. What can we do now? Okay, so I just want to give a bit of a perspective in terms of outlook. There are opportunities out there, so we need to grab them as a country. First thing is Japan is giving a $2.2 billion package for companies to move their manufacturing out of China. How much of that can Sri Lanka get? Leveraging its very strong historical relationship with Japan. That's a very important factor. And our business community, facilitated by the government, needs to be able to grab that money and get a portion of that value chain to Sri Lanka, right? Second thing is interesting insight that came out. While Wuhan was fully shut down, being the epicenter of this crisis, its semiconductor factories kept running because they were so critical, right? So if we are looking at restructuring our economy and looking at critical manufacturing, are these industries that we need to start, looking at? I hear business leaders continuously echo about the importance of institutions like Slim Tech, right? And what are we doing? Are we doing enough? Can we help them more? Because we really need to look at the innovation side, especially going forward. Then global trade took a hit, but people are going to trade, right? Trading is going to come back on track. So Sri Lanka, we are talking about being in a strategic location and being a logistics hub. Are we doing enough to develop that sector, right? Because remember, trade is not, it's going to take a while for it to get back to normal, but it's going to be an even more competitive market when the economies start opening up. So are we doing the right things in our country to leverage these opportunities? Tourism, right? No matter what happens, people will start traveling. They will be a more sophisticated tourist traveler. I mean, I have an inbound travel company that I started my entrepreneurial journey with. It's going to be a more sophisticated traveler. But are we ready in terms of proactive testing, the facilities requirement? Is our tourism industry gearing up for that? So those are the areas we really need to look at. I mean, we talked about this app that Singapore did. They opened it up to all the developers, okay? But then why haven't we enacted that? Why hasn't our IT industry gone and put out this contact tracing app in Sri Lanka? It was let out to the community on March 20th. Now we are in May 9th, right? So I think we need to seize more opportunities going forward. There are opportunities out there. I mean, to end with a very simple personal example, as an MBA student, I had to do an internship, right? And all the companies are cutting down staff, laying off people and everything. So it's a real challenge to look at, internship, and in 6 months, we need to enter the job market. But I got an internship, marketing and business development. I've been studying blockchain for a while in university. It's a blockchain company looking at the PPE sector, personal protective equipment. So that's a booming sector right now. So I'm really amazed at how they pivoted from their initial plan to this. Startups can do it. Big companies can also pivot, right? As we are seeing, the apparel sector in Sri Lanka is moving to PPE. So we need to look at all these opportunities and maximize them. I think there are a lot of opportunities out there. So Sri Lanka has everything it needs to succeed, but somehow we keep missing the ball, right? So I hope that this COVID is the right impetus for us to start getting on the right track.
Perhaps a lifetime of opportunity should be taken in the opportunity of a lifetime, I suppose.
Yeah, of course, of course.
So, thank you, Dinal. I think Sri Lanka has at least up to 20 million, 10 million on internet, and people 6 million, over 6 million on social media. So smartphones, I think close to about 6 to 7 million people have smartphones. So perhaps with a app of that nature can reach, has a direct infrastructure to reach out to about 1/3 of the population, like, straight away. So yeah, a good thought. And thank you for your thoughts and contribution and your opinions. And now with that, let me move to Dr. Dulshara. Dulshara, this perhaps will be your closing remarks as well. And tell us, how would you, learning from South Korean learnings, what would you recommend for Sri Lanka as we go back to work on Monday?
Yes, Dinal, looking at South Korea's story, as Dinal said, the first thing that I would say is testing is absolutely critical at this stage. And South Korea successfully used this 3T approach, testing, tracing, and treatment, to help continue decreasing the number of patients. And they have also get the artificial intelligence involved in developing test kits and vaccine trials. So first thing that we can learn from this is that we should increase the number of tests that we do per day. And the second important thing is that we also should start, especially the developing countries like us, we also should start harnessing biotechnology to harness health, which will also give you an economic impact later. And the second thing is South Korea is making full use of their research capacity. I think Dinal was also highlighting this fact. So we also have to think of using our research facilities to its maximum and support predictive research on COVID-19 as much as possible. And another thing that I want to say is that well-funded, efficient system is essential for dealing with a disease like this. So if we take South Korea, they have most of their hospitals are private hospitals, but 97% of people are covered by a health insurance system, which is compulsory. So this balance between the public and the private sectors have given accessibility to all patients to go and get treated. So the people will get treatments and get well soon. And then again, they also have protective gears, all safety measures in the hospital. So the medical staff and the hospital, other physicians and everyone is protected, which is very, very important for countries like us. We have been reporting certain situations. And then, so because of that, the government should prioritize supplying all necessary equipment and gear to hospital at all costs. And another key important thing is that the transparency they had with the public. So I think we also have to have this transparency with the public, give all the information so that they can take care of themselves. They can be careful of what they have to do. And in my point of view, the most important highlight about South Korea is the way that they obeyed the very strict social distancing rules, which I will call as very, very impressive, because they battled this because of the collective efforts of the medical teams, governments, and the other private and public sector personnel, with the help of this disciplined general public. They could even do this parliamentary election on 15th of April with very strict social distancing practices. And no cases were reported after 14 days of incubation related to this election. So I really hope that all nations, including our people, will practice social distancing as they did. So currently, as all of us are struggling, and the countries with different capacities are struggling together to battle with COVID-19. And I hope South Korea's experience will guide everyone to battle against COVID-19, and hope the world will rise again soon. Thanks, Peshela, for inviting and empower yourself.
Thank you, Dr. Dulshara. Actually, I think South Korea being having the ownership of some global brands like Samsung, Hyundai,
Yes.
plays a very key role. So, and also how they have managed the election and post-election,
Yes.
no cases, pretty impressive performance. Perhaps I think Sri Lanka is also, there's a debate whether to have an election or not, probably not relevant to the topic. So then let me thank you for your contribution, Dr. Dulshara. And now let me bring in Chanaka. Chanaka, okay, this is your closing remarks as well. So tell us, what do you recommend? What are your thoughts on how Sri Lanka should adapt to the new normal as we start work on Monday from the German experience? And as a fellow Sri Lankan, what would you recommend Sri Lanka to take forward? How to take forward?
Yeah, and I think, first of all, I have to say, Dinal and Dr. Dulshara really explained really in depth what we could expect. So I will change my remarks to in different direction. So Germany succeed this or Germany in the way to succeed this COVID-19 pandemic due to they did testing in the first place. Just to summarize these things, they did testing from the very beginning, and they ramp up their healthcare capacity from the beginning, and they understood the timeline. That means the global timeline as well as the local timeline, and also they understood their cultural differences with the other countries. And the fifth part is the government and the people. Dr. Dulshara really mentioned this one. It's a collective effort. It's not an individual and discrete effort. It's a collective effort. So the government and the people should approach such a problem together. And this is also the biggest strength that Germany has. The biggest strength in Germany is the rational decision making at the highest level of the government, and combined with the trust the government enjoys in the population. That is one of the most important things. We can discuss all the things, but if you come to the end of this discussion, that's the important thing: how the government's rationally approach to a problem, and how the people react to it, and how the people what is the trust people putting on them. That's one of the important things that we could learn when we come to Sri Lanka. Because if you think about Sri Lanka, how our politicians think about our population is questionable, right? And due to that one, our population doesn't have any trust on them, and this is really a problem, because it's the both groups we try to approach discreetly, not as a group. That's the one thing. And the second thing is, this pandemic shows, this is not about health of the people, health of the community versus the economy. It's not versus, it's not a game. It's very much intertwined. It's very much interlinked, because we need to have a strong economic system in order to have a very good, robust healthcare system. For example, this is true for everything. So it's very intertwined. So now it's time to find the right balance. We need to find the right balance in order to go forward. I mentioned throughout my discussion, like we cannot turn the tables overnight. We have to take step by step. We have to go step by step forward, and then only we could come out from this pandemic. And well, to be honest, that's what I can tell. That's my take on it, because Dinal and Dr. Dulshara really explained it pretty good. What we could really go on and doing in terms of economy and in terms of some of the other approaches. And then thank you, Pesula, for inviting us for sure, inviting me for sure, and of course Empower SL. Thank you very much. And we hope to see great webinars like this one in the near future. We will sure that we'll keep in touch with you, and we'll keep tuned to your channel.
Thank you, Chanaka. Thank you for the insights. Perhaps I think a German, another country who has risen from the ashes after a world war. And
actually 2 times for sure.
From what I can pick is now from what Dinal said, then from what you said is now Germany perhaps looking at more like an export diversification from depending on the automobile, perhaps looking at the biotech and other
this is also some kind of misunderstanding. Germany is not just automobile. They already have a huge, in the first place, I said you have to understand your economy, how it's going, and you need to have a robust disaster management plan, right? So one of the plan was from the beginning. It was a long-running program in Germany. They diversified all the time. They all, I mean, if you think about the help that new businesses get from the government, even for a foreigner who's come here, it's unbelievable. And these are the really important thing. And it's, as I mentioned, it's not overnight. We cannot turn the tables overnight. It should be a long-term plan. It should be a plan that goes between governments, throughout governments. And that's the only way we could go for it. Otherwise, we will keep missing the ball, as Dinal mentioned.
True. That's true. Thank you very much. And Sri Lanka has, perhaps you have a history of missing the opportunity.
Sure,
right?
yeah, that's so,
true. Never miss an opportunity, as Professor Sali once said.
Yeah,
so,
exactly.
Actually, now with that thought, let me bring Yasasi in. Yasasi, what are your thoughts, on how Sri Lanka should adapt, especially now as a country, you come from a country who is ahead of the curve, and you all have opened up a little bit. So what are your thoughts, how we should adapt as we open up on Monday?
Thank you, Peshala. I think when I'm talking about New Zealand, the main advantage New Zealand had was they reacted very as soon as the pandemic hits, they reacted early. So they got the advantage of going for a lockdown. Through that, they managed to get the evidence where they can evaluate them scientifically and take decisions. They didn't take decisions overnight. Only what they did was they evaluate all evidence step by step, and they're taking measures and they're taking decisions. I think the government also doing a good job by taking rational decisions, and they have that authority to take that without any disturbance from other parties. They take their own decisions. I think that's a main key. And the other part, the people also cooperate in the government. I think in that way, we can't compare Sri Lanka with New Zealand in that case, because New Zealand is a country which has 5 million population, whereas Sri Lanka has 20 million population, a small country, right? And when this country went for a lockdown, it wasn't hard for people because they were allowed to go outside, go for walk, because mental health was something taken care from the higher level. Whereas Sri Lanka, some people, they were stuck in small houses during the curfew situations, and they are not even allowed to go out of the houses, right? So whereas understand the stress and the things these people might be having. So I don't think that pushing people that hard for months and months give any benefit for in their health, mental health wise. I think Sri Lanka has to consider that fact as well in this situation, because it's okay for urban living people who has big houses and people who has money, but what about people who has day-to-day earnings and who has 5-6 people stuck in one small house in slums? So I think government will have to do certain, I know government helping them out, but in terms of their mental health, I think government will have to do some sort of a support as well. And the other thing I think the government has to look after is, if the country is opening for business next Monday, I think transportation is a huge biggest issue in Sri Lanka. Whereas these countries, people has their own vehicles and transportation is really good service. But whereas Sri Lanka, even if you say, okay, maintain your social distance, it's not practical once the country is open. You can't ask people to maintain distance where there's no enough buses or trains available. And I know, I have seen certain things, I think Sri Lanka tried to manage it beautifully in the initial stages, whereas some stages it was not perfectly but all right. But I think government has to look after certain weak points where they can give people some sort of support. And if government can help people to work from home, at least till it gets sorted, till all the clusters were identified. I don't know whether all the clusters were identified in Sri Lanka. Till all the clusters identified, at least till they know there's no communal spreading happen in Sri Lanka. If people can still work from home, I think that will be ideal for Sri Lankan situation, because there's no proper transportation, where people cannot maintain social distancing. And I think Dinal and Chanaka and Dusha, they discuss other manners. I think I was actually want to talk about transportation and mental health wise. And I think people also have to understand the situation, how the government is ongoing. It's not one battle, there are two battles: economic battle as well as health battle. And from people's perspective, they will also have to understand the situation and support the people. I think social media is not no support for government, and there have been like people, and it has to be controlled as some measures, because it doesn't do any support at this point. And considering all these facts, I think if the Sri Lanka can reevaluate all the facts and evidence, and without bouncing back, having bouncing back situation, rather doing that, if they can have a proper plan, evaluate all the measures and take one decision and go through that decision, like Sri Lanka can also come out for this C-19 situation.
Okay.
And I think, I would like to thank to Peshal for inviting me for this, and good luck, Peshal, and Empowerment Sri Lanka.
Thank you.
And hope to see you more programs from your side.
Sure, certainly. That's our role, actually. Thank you, SSC. Thank you. Actually, you brought up a very valid point: the social cost, right? That the government has to manage. I think for you to you to face this crisis, one important fact is the mental fitness, which is perhaps the motivation level and the endurance level of the citizens to face it and move forward, which is a very valid point, Yasasi. Thank you for that insight as well. And now let me move to Romita. Romita is now, Yasasi suggested actually also, how many of people can continue working from home, right? I think Japan doesn't have perhaps a need like that, but a valid point is actually when per se, I am actually thinking whether how many hours should I actually be at work, right? Whether my physical requirement at work. So that's something that actually corporates and the government can think. So with that thought, just tell us how Japan is planning to manage, move forward in this new normal. And also, what are your suggestions, the learnings that we can get from Japan, and your suggestions to Sri Lanka? Yeah, over to you, Romy.
Okay. Having with a lot of critics, that I can say that Japanese model has shown some success in balancing the economy and as well as the isolation of the people. So what we can gain from these experiences is the accountability or the responsibility of Japanese people. And they are self-motivated and they know what is they are responsible. And the nationalism they have, the Japanese nationalism they love their country, and each and every time they're willing to use technology and they are willing to grab the technological opportunities to their daily life. So that is something common in Japanese culture from the history we know, and there are a lot of things we can take as Sri Lankans from those qualities. So what my idea is, in this kind of pandemic, we should not only focus about the pandemic itself. So it's very important to look at the future and what is happening in the post-corona world. And it's not virus to make decisions, and it's up to the politicians to do the decisions. And we as citizens, what we have to do is supervise the politicians in order to make better decisions. And one thing we have to rely on science, education, and as well as the self-motivation rather than surveillance. So I'm not against about the surveillance, using surveillance into our life. What Japan is doing is their main thing is self-motivation. So they have surveillance, they have technology and everything, but the core of the society is the self-motivation and attitudes of the people. So we need to rely on that, and we need to, I mean, that we have, before appointing good politicians, they are saying that we have to appoint good citizens in a country. So that's the main thing that Sri Lankans can get from Japan. And then second one is the unity of the country. So in order to fight against this kind of disaster, you need a national unity. And as well as this is a global virus, we need global solidarity in order to eradicate this kind of virus from the world. But unfortunately, we don't see that kind of behavior from world leaders. So that is something important. Someone should take the leadership from the world. And Sri Lankan government or Sri Lankan political parties can do something in that in this moment. I would suggest that we can promote that even in political parties, we can suggest them to move to e-political campaigns rather than banners and posters and having assemblies in this kind of era. So they can move, they can change their track, and the government can also promote this kind of thing in Sri Lanka. And to sum up my words, I would like to express my solidarity to all the healthcare workers in Sri Lanka and throughout the world, and the military persons, scientists, and the others, those who have sacrificed their lives and still some are fighting with corona pandemic. And thank you very much for all of them. And thank you, Peshala, and thank you, Empower Sri Lanka, and thank you all the attenders to this session.
Thank you, Romita. Thank you for that thoughtful comment about remembering the essential workers, the health sector, the military, to the guy who delivers you bread and butter, everyone who's right now at work, taking the risk head on, who's working out there to keep us afloat. Well, yes, the big thank you from Empower SL for them, and as well as a big thank you from the panelists who join us despite the busy schedules. Actually, you have brought in a lot of insights. To sum up, I think from the developed nations, what we can learn is how to convert a crisis to an opportunity and size it up the opportunity and speed to market. The critical thing is how fast you can get out there and seize the opportunity. Perhaps that's a learning for us, and also be mindful about the social cost. And also keep a country unity together and rise up as one Sri Lanka. Perhaps a very good summary and I think opinions and viewpoints. Thank you all once again. And let me take this opportunity to give an introduction about Empower SL. Empower SL is a policy think tank that mainly provides commentary and create dialogue between different stakeholders in the areas that concern the country competitiveness. We do provide webinars, and we do have forums in the non-lockdown scenarios. We have small gatherings. So stay tuned with us in different formats. We are on LinkedIn, Facebook, YouTube, and Twitter. And join us, and you can perhaps contribute. Stay tuned for further events of this nature. And thank you for joining us today. We've taken a little longer than what we've anticipated, but I think that was worth, because with all the insights came. Thank you, everyone, and have a pleasant day. Goodbye, and be safe at work. And as we open up on Monday, thank you, everyone.
Thanks, Peshala. Thanks, guys. Take care. Have a good
Thanks, everyone.